leg lifter, not a cane. But we don't have a leg lifter. So this is my leg lifter. Everybody know what a leg lifter is? Yeah, lifts your leg. It looks like you remember the fake dog leash?
Yeah.
Right, the wire with the loop on the bottom, and you make believe you're walking your dog. It's just like that. And they use it with like hip patients, total hip replacement patients, to help them get their leg and move their leg around so that they're not lifting it with their muscles. So what you would have them do is using a device like that, and remember, they may or may not have grasp, so they may have to kind of use tenodesis. Sometimes what you can do is put a cuff handle on a device. So they would be able to just kind of put it on like this, and that would be how they would grab it. Okay, so that's a cuff grasp. So you would have to either use a leg lifter device like that, or a stretching strap. And to do the hip, they have to bring it up into flexion, and to do more hip flexion, then pull it in. To do internal and external rotation, bring it out. Okay. To do the foot and ankle, without their shoe on, they can do plantar flexion, dorsiflexion, toes extension. Okay. Version.
Did I mishear you when you said C5, C6?
No, I said C7, I think.
Oh, okay.
Okay, but again, they would have a tenodesis grasp. I'm not going to go through, but you would. It would be using that grasp. Okay. And sometimes, like I said, you can actually use. If they can be pre-positioned with this on, then they can kind of use, different positions on a strap. Their elbow. Again, you kind of have to do it according to how they're able to move, and it usually is a patient by patient kind of thing. Okay. And then, of course, put that back, kind of use momentum, kind of go up, push their leg straight, like that. So that's foot and ankle, knee. For hip, you recommend that they lie on their stomach. And in that range of motion handout, if you look at one of the pages, it actually shows a picture of someone lying on a wedge on their stomach. It recommends 20 to 30 minutes a day to undo the extension. They can also do it themselves in side lying. If they can get a stretching strap wrapped around their leg like this, go into side lying and kind of pull the leg back and up behind them to get hip flexion and knee and the quads. Okay? So self-range of motion is important. They have to be seated up like this in order to do all this. They can't be flat. They're not going to be able to do it. Okay, so you got to teach them how to kind of get up into this position with their back resting on something. So hopefully they have a bed that the back is up on. And progress. So once they get to C8, it's easy. Okay. For skin checks, they need to, that's when they get to use their fancy dancy mirror. And so they need to kind of get themselves onto their side and kind of use the mirror to kind of see the different areas of their body. And then they can see something up higher. Okay. Then they can also, that's the posterior, obviously they can see anterior on their own. Okay, so you want to tell them to check specific areas. If I put it on a practical some point in the future, I would say, what areas are you going to tell them to check the posterior area? Heels, sacrum, ischial tuberosities, occipital protuberance, something like that. Okay? Not for this one. Later. Next one. Okay, so that would be, you might want to take a look at some of this stuff. Won't be able to sponge.
Oh, yeah.
Scratching stuff, that's a dressing stick. I'll let the OT show you how to use that. All right, so that's, excuse me, basic range of motion. As far as you performing range of motion, you just need to be cautious of any kind of spasticity. So hand placement, if you have someone with a lot of spasticity, because you could make it worse. So you just have to be cautious of your hand placement, just like you would with spastic stroke vision. So, positioning, you're going to worry about what muscles they don't have or compared to what they do have. So, imbalance of rounded joint can lead to contracture. So, imbalance between the rotators at the shoulder, imbalance between elbow flexor and extensor, imbalance at the hip, imbalance at the foot and ankle. Okay? So, you just need to know what they have and what they don't have. And then, whatever they don't have creates the imbalance, so they're more likely to contracture in the direction that they do have. So biceps would be okay. So that's positioning and range of motion. Okay, and skin checks. All right. What's next on that latch? Pressure relief. Pressure relief, something that they need to do every 10 to 15 minutes. And they need to hold the position to completely relieve the area for 2 minutes. Research has shown this. Okay? So in a wheelchair, I brought my waders.
Not that it makes a difference. Yep. Not that it makes a difference now.
Okay. Have 800 hairs. That's like the 18th time. I was actually doing something one day with a class, previous class, and I actually still see this student. It makes me, every time I see my lab. And I was doing something, same thing. My glasses were flying out, then my pen came flying out, and he looked at me and says,
You were wrong.
What you said?
Anyway, it was funny. And so now I see him, he lives in my neighborhood, so I see him drive by all the time, and he's always waving, and that just keeps coming back.
You were a fan of that.
Did they tell the story when you were last?
Oh yeah, same thing. Every time I bend down, everything. It's the same. Some things just don't change. Except that was like reflex hangers, stuff everywhere, postcards. I mean, it was just and then every time I bent down to pick it up, something else would fall out. So it was just. I remember they just stood there and laughed at me. Like, all those mature therapists. Anyway, all right. So pressure relief. What methods did I say? This is a C6 patient. What do they have? What can I do?
Push up.
Easy, right? The thing thing is, a new patient probably won't be able to hold it for 2 minutes, but ultimately, this would be the way that they would be able to do it. Okay? C6 patient.
What is this? Did you say?
Yeah.
No, I
that's
said
what she-
C7.
She did say
Oh,
she
I said,
She
I
did.
said,
That's
my
what
head.
that's how I was so confused. I was like, okay.
C7, that's fine. In my head,
She said.
I
I said
understand you,
C7.
Dr. Wall, because I said
Yeah,
triceps.
that's what threw me off.
That's why I thought I said triceps. So C7 is triceps, okay? C6.
Weight chest.
Okay. So what muscles do I have?
Bicep.
And what one do I not have that's kind of important? Okay. So, in order to do the weight shift, how do I get down? I didn't talk about this in the class.
Out of the chair.
Just lean forward.
Oh. Pull the chair because you have biceps. You can pull it.
Lock your
Flying out, yeah.
your hands.
So, good question, right? So, what you have to do is they kind of have to use their chest muscles in something called a reverse muscle action. Okay?
I heard about that.
Remember I said in kinesiology we learned about reverse muscle action. So instead of contracting insertion to the origin, it's now kind of fixing and contracting so that you're controlling the opposite direction. Same contraction, okay? Just controlling it slightly differently, right, Dr. Bitterman? She's a kinesiology. Yeah. So they would have to kind of walk down. Going down isn't the problem. Coming up is the problem, right? So right now, I can, if I check on my patient, I literally rub my hand underneath their ischias to see if they're clear. If they're clear, then that's a good pressure. Getting up is going to be more difficult. A couple different ways they can do it. If they have the range and they can get themselves hooked using their biceps, they can kind of pull themselves up that way. Okay, that's one way. Someone didn't like that answer. Or I don't know, it sounds like you disagreed. The other way is to kind of use your chest muscles. So the way to do that is they kind of have to, and they fix their hands down and they use their chest and biceps to pull the elbow straight. Pulling in this way. So they're not pushing straight, they're pulling in and locking that way. But it has to be in this position to optimize the position of the pecs. The clavicular portion is relatively high. Look at a C6 in your book, somebody. I think it should say sternal clavicular portion of the pec. Oh. The other thing you can do to add to that is some momentum with your head. So if they get themselves in this position, they can kind of pull in through their arms using their biceps and their pecs. Okay. It's not something that you can do on your own, honestly, because you have normal muscles, so it's very hard to duplicate. You have to tell the person kind of what to do and kind of manually help them and guide them through the motion until they get it on their own. But when you try and fake it, you can't shut off the other muscles, so it's very hard to do. Okay. An easier way to do it, in the beginning anyway, is to lean over, and typically, this is kind of high. Usually you get one that goes up and down, that adjusts up and down. So another way to do it, I'm sorry, I'm going down. Watch your knees. Is it like 8, 7, 8, 9, 8? That was amazing. Horizontal back. there's a big table, there's a big table, keep going. Keep going. Going. What was it? At the end of the chapter. Keep going. Yeah, keep going. It takes like 3 tables.
I'm not good at foot.
You feel a little stressed? Now you want.
I'm still
Maybe not. Is that it? Is that the table? Summary. Hey, go back.
According to Wikipedia.
No, we don't go by Wikipedia.
It's a very reliable source.
It's on 921. 921.
That's what I'm thinking.
Thank you. Getting a little nervous there. So, in the clinic, if I'm working with patients and my patient arrives early, I would encourage them to kind of lean over onto a table like this, and then they can kind of pull themselves back. But if you notice, this one's kind of high, so they're not going to get low enough. You have to be able to get over enough. See how I'm clearing out? But if I'm here, I'm actually not. So it really has to be that you can run your hand underneath. And that's what I'll do. I'll have them do a pressure relief, and then I'll run my hand and say, not enough, keep going. Even in a motorized wheelchair, when they have a tilt and space chair, do pressure relief, they have to go 65, at least 65 degrees back. And if you've ever put yourself in a chair, you guys did that, right? At the mobility clinic that you do. That's pretty far back. You almost feel like, whoa, I don't want to go any further. It's almost, feel like getting to 90 degrees. It's pretty far back in the chair in order to get appropriate pressure relief. So a motorized wheelchair, they tilt back at least 65 degrees. If they don't have triceps or the ability to push up, they either lean forward and then kind of walk themselves back up, or they can lean to either side. So if I ask you on a practical, this person is a C6, show me a pressure relief technique, don't show me this one. You understand how I could ask that? And I can actually write that into a question too, a written question. Pressure relief. Any questions on pressure relief or skin checks? Next.
Activities.
This is the biggie. All right. So we already kind of talked about rolling. What techniques can you use? I need a patient.
Tap.
From this point forward, we're all going to be practicing. Everybody understand? Now I have to bring it back up. That's the wrong one. So what techniques can I use to assist with rolling?
Cross over the leg.
Also like
Follow the
hands.
hand.
Follow. Head
Follow
follow.
the hand, yeah.
Oh, so, okay, that's an interesting point. Okay, so go down. He's a C6 spinal cord injury patient. So, Susie, come in and teach him the techniques that we talked about.
C6. This head already needs to be down. Okay, where's the little guy? The straps are up there.
You can put his leg over. You can put his leg over.
I'm helping him roll? Okay.
Oh, yeah.
I just have his legs crossed over like
That makes it easier. Eventually, he's got to be able to do it without doing that. But this is for teaching purposes. It makes it easier. Shifts his center of mass over, so it takes less effort to roll. Okay? What does the head need to do?
the head needs to turn in the direction we're rolling.
And what? Flex, extend,
Extend as well.
flex, extend,
Flex.
flex. correct. That is correct. Extension is for what?
Prone to supine. Okay,
Correct.
that's right. Okay, and then we're
So
gonna
flexion. No, not that one. This one. Chin to chest. And then
just arms
He's a
there.
worse roller than I am.
okay, so here's the point. C6, what's gonna happen?
He can't extend.
So is this a good technique to show him?
He says he can't grip.
Alright, so just bring that hand.
Please don't say grab the bed rail.
No, I wasn't, he can't grab
He's
anything.
trying to grab the bed rail.
I'm just asking him to shift this
You're
arm
right.
So he
over
can
here
do
so
this.
he can.
Put it back.
Oh, it's good.
He can do this,
If you made it.
he just can't do this. Or he can do this. This. Right, because he's got biceps,
Right.
right? So he can keep it below 90 and do this to breathe, and then he just can't do this.
So throw your arms in that
Exactly,
direction.
flex your
and-
head, and that's exactly right, throw your arms. Good. And then to go back, what does the head do?
The head extends and rotates to the
And see, he's
center.
almost going back already, and then he brings the arms, he brings them back the other way. How can I make that easier for him? Let's say he can't do that the whole way, what can I do? With pillows, make it a shorter distance. Everybody good with rolling? Quasi? Oh, okay. What's next on the sheet?
Prone on elbows.
Supine on elbows? Let's do supine on elbows. Because this one, it's not on there? Oh, well, it's gonna be next.
Two more.
Okay, so now supine on elbows, stay there. I wanna show you. How do you think, what do you think would be, a good way to get him, thinking, remember how we did prone on elbows? To get him supine on elbows.
So the opposite hand, or, so if he wants to bring this arm up under first, I was gonna push
Let's do
down
them together.
together. Okay. So I want you to push against the mat. Push down on the mat with the back of your arms. And this is gonna come up,
And what could help that come up?
flexion
Of his,
this cervical. Right here. Let me see what else we like.
now you've shifted his center of mass down, that's good, making it easier.
Would you want to help him keep this down?
Now that will
No.
stay down, that's not gonna be a problem. He doesn't have a problem, so.
I would kind of.
And what does he gotta do with his elbows?
He's gotta bring his elbows underneath him.
Jam them back. Absolutely, so come on down. So, on 3, what I want you to do is you're gonna rock your head forward. 1, 2, 3. As you come up, I want you to jam your arms down, kind of rock back and forth and walk them back. Ready? Okay, so 1, 2, 3, walk them back. So I help him weight shift, and I cue him, just like you cue the pecs for a prone on elbows, cue him to come back. So let's do it again. Go back down. So you're gonna bring your head up, and then kind of shift your weight, walk your elbows back, okay? So 1, 2, 3. Okay. Another way, I'll show you 2, and then we'll practice. Second way, he's C6. 6, right? I said that right. He's C6. What he has what at his wrist? What does he have?
Extension.
Okay. So he can use this, right? And he can use this. Okay? So what he's gonna do is he's gonna move using his posterior deltoid, he's gonna rock himself, gain some momentum, and work his hands underneath his hips. So you're gonna start, and you can turn your head too, and so you're gonna, there you go, work your hands under, perfect, good. And what we're gonna do then is you're gonna bring your head 1, 2, 3, and I want you to pull both arms using your biceps and your wrist. walk your elbows back once you get high enough. Okay, you understand? Okay, so 1, 2, 3, pull. So he can pull this way. He uses your wrist to lock in. Sometimes they'll actually have them put their hands in their pockets. I'm not sure these are good or not. So put your hands in your pockets. Okay? And then what you're gonna do is pull through the wrist and then pull with the biceps through your feet. Well, you know, this younger generation. It won't work with me that way. I thought it would, because this is better, but never mind. So that's the other way. I mean, I can show you on myself. So kind of, and there go my glasses. So you kind of pull this way. 1, 2. Okay. What do I need to have at my shoulders before I do this position?
Extension.
So range of motion, right? I have to have this range of motion. If I don't have this range of motion and I jam their arms back, what part of my joint capsule?
Posterior. Anterior.
I'm basically mobilizing the anterior joint. Okay. All right, so we're going to practice 2 methods to move from supine to supine on elbows, and then rolling. Using momentum, we're going to practice on a C6, because that's probably one of the harder levels that will achieve some independence in bed mobility.